Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. Here are some of the highlights this hour. NSAS protest continues across some parts of the state amid the COVID-19 pandemic. Reports say a warehouse in Lagos where palliatives are stored looted. Health Minister Dr Sage Hanire warns Nigerians not to throw caution to the wind on the observance of COVID-19 protocols. And Spain confirms COVID-19 cases. It surpasses 1 million as Europe's outbreak worsens. Now, it is not clear how much of COVID-19 sample collection and testing is ongoing across states in Nigeria owing to the NSAS protest situation. However, the latest figures coming from the Nigeria Center for Disease Control, NCDC, has it as of the 21st of October, that's last night, 37 new cases were recorded in the country. The Presidential Task Force on COVID-19 had earlier this week said that cases of COVID-19 will definitely increase in the coming weeks due to the mass gatherings from the NSAS protests. Now, the new cases were reported in 8 states and the Federal Capital Territory, which recorded 8 cases, followed by Lagos 7. 5 were recorded in Taraba, 5 in Rivers, Adamawa recorded 4, 3 in Kaduna, Anambra 2, 2 also in Osun State, and 1 in Ogun. Till date, 61,667 cases have been confirmed, 56,880 cases have been discharged, and the death toll is at 1,125 recorded in the 36 states and the FCT.
The reason why they brought this stuff here is because they know that this place is not, people don't know it as warehouses and all those stuff.
Social media video circulating shows a warehouse located at Mazamaza area of Lagos State being looted. According to reports, the warehouse has materials donated by public-spirited Nigerians for distribution to the less privileged. Some of the items were donated since July 2020 at the peak of the coronavirus pandemic. The items include bags of rice, wheat, noodles, and other food items. In the meantime, the Lagos State government has condemned in very strong terms the vandalization of the warehouse where all the food palliatives donated to the Lagos State government by the private sector-led coalition against COVID-19 COVID group. The state governor, Mr. Babajide Sanwo-Olu, had on September the 22nd taken receipt of the food palliatives from COVID meant for distribution to indigents. According to the Commissioner for Agriculture, Mrs. Abisola Olusonya, in a signed statement, she notes that the warehouse in question is not state-owned and its usage was made available to the COVID group, adding that the state government had been allowed to commence rebagging of the food items allotted to it from the quantities meant for the southwest states. The distribution of the food items was ongoing but had to be halted due to the protests. The state government, however, says it regrets the invasion of the warehouse and appreciates the support offered to the citizenry of Lagos. Now, away from Lagos State, we'll bring you visuals right now of a situation in Asaba, that's the Delta State capital, late yesterday, which further disrupted peace there as more violence was recorded. As a result, the Delta State Governor, Ifeanyi Okowa, this morning ordered the closure of all private and public schools in the state. In a statewide broadcast, the governor also imposed a 48-hour curfew in the state from today as structures set ablaze by rampaging youths.
That man, so.
Security operatives in Delta State have foiled a jailbreak at the Okere Correctional Center in Warri, Delta State. Report has it that security operatives had engaged the hoodlums who tried to attack the prison in a gunfire, foiling intended attack that would have led to the escape of inmates. Delta State Commissioner for Justice confirms to our correspondents that all inmates are still in the correctional center, contrary to reports on social media that the inmates escaped. Delta State currently has confirmed over 1,800 cases of the coronavirus. Now, more reactions continue to trail the violence that characterized the NSAS protests across the country. The Executive Secretary of the National Human Rights Commission, NHRC, Mr. Tony Ojukwu, says now is the time for protesting youths to form their own political party and take charge of governance in the country.
We advise the protesters to please sheath their swords, let them give peace a chance. And we have advised government at all levels to take immediate action to start addressing the demands of the protesters. At our own level here, we have set up a panel of inquiry, a panel of investigation to look at complaints from SARS and any other members of the public. We are also working with Nigerian Bar Association to see how those who have genuine petitions can be assisted to package their petitions and also to represent them at the various panels of inquiry in all the states. These are immediate steps we are taking, and of course we have also formed through the stakeholders forum five subcommittees that will look at all aspects of the recommendations of the presidential panel, whether it is that of recruitment, whether it is police salaries, whether it is police infrastructure, whether it is the standard operating procedures. There are subcommittees that are looking at all this. And we say that this is a process, it's not an event. So we would plead that the protesters should please sheath their sword and give these things time to mature. There must be a turning point in the life of every nation. I think this is the moment. This moment has come, and things will never be the same again. But we need to be alive. We need to have hope and work towards these policies. If I were the young people, what I would do now is a simple thing. Yes, we have made all these points, we have raised this consciousness. We form a young people's party and register for 2023 general elections. And I can tell you that if they can organize themselves into some leadership, they keep saying they don't have leaders. I don't think that's the right way to go. You must have your leaders, because the government cannot be talking to all of you at the same time. But if you form a simple thing like a political party for the youth, and they elect their leaders to represent them in the National Assembly, in the State House of Assembly, in the governorship positions at the state levels, you'll be shocked that a lot of them will get elected. And that is how they start being relevant in influencing legislations, policies, actions, and so on and so forth.
The Minister of Health, Dr. Osage Hanire, says the ministry is considering the possibility of emergency medical services as a result of civic unrest in some parts of the country. Dr. Osage directed the federal tertiary institutions not to reject casualties with evocative injuries on account of inability to pay their bills. He says all such persons are to receive treatment without delay, as the administration places priority on the health and well-being of citizens and residents and is committed to ensuring that lives are not lost needlessly. We have joining us right now via Skype in Abuja, Dr. Akiala Ishaku. He's a public health expert. Thank you for joining us on the program.
Thank you, Melissa, for having me.
All right. First, I'd like to ask that with what is happening, would you say that there is an emergency situation in terms of public health with all of the crises going on right now?
Actually, Melissa, we are supposed to declare a state of emergency on our public health. And this is because security plays a higher premium when it comes to public health. You will discover that people tend to go for food, shelter, and their well-being to be well informed about infectious disease and about public and their surrounding public health. So I think with what is happening with the NSAS process, although it is a very, very sensitive moment, but I think that we need to declare a public health emergency on our public health sector. And then we need to also strategize on our standard operational procedure in combating a lot of public health problems in this moment of protest, because it's quite key. When you look at indices, the safety net indices, you'll discover that actually it is quite poor. So I strongly believe that we are at an emergency and we need to declare public health emergency on our healthcare sector.
Now, Dr. Ishaku, clearly there is also a drop in testing of COVID-19 across the country. Last night figures just less than 40 in numbers. And this is with regards to our efforts at flattening the curve. So are we going back to ground zero in terms of our response to the pandemic?
Absolutely, we are going to ground zero in terms of our response. You don't expect people being under curfew like in Lagos, like in Benin, like in Ondo State. Now we have in Delta State, and you know that will impair our contact tracing. That will also impair our case management for COVID-19. So I strongly believe that we have gone to ground zero, and that is why in my prescription that we need to standardize our standard operational procedure for this. It is quite key for us to also tackle. We need to also come up with an emergency national health plan to tackle COVID-19 at this moment. So what I expect the federal government to start doing is that we need to also integrate the COVID-19 in all our national public health response. For example,
Okay, we appear to have... can you hear us, Dr. Ishaku? Are you still there?
Yeah, so for the malaria program, for the HIV program, the TB program, it is expected, what I expect the federal government to do now is by now, we would have integrated COVID-19 into it. And as we begin to reopen schools, we would have come up with a national policy to mandate all pupils and students resuming to prevent the COVID-19 certificate. And I think the issue of AFU and federal government is involved. And I hope that you know that that would have also handled the issue of the NSAS process, because a lot of our students of the university and tertiary institutions are at home, and they also partake in the national process. So it is kind of a multi-dimensional, precursor and metabolite for most of this response for this process. So I think what we just need to do is to come up with an emergency national health policy to see how we can be able to tackle this pandemic. We have two pandemics before us, Melissa. We have the COVID-19 pandemic, and we have the NSAS social unrest before us, and also we also have another tragedy, which is the emergency public health.
A pandemic in a pandemic. Thank you so much, Dr. Akiala Ishaku, who's a public health expert. Thank you for joining us on the program at this time.
Thank you, Melissa, for having me.
What you're seeing was the tension in the Ikoyi area of Lagos State inside the Ikoyi Correctional Center. Reports from the center saying that there were sporadic gunshots within the premises. Trouble began following fire outbreak in one of the blocks. It's not clear who lit the fire, while the inmates had attempted to cash in on the situation to escape, forcing security personnel there to shoot into the air. The matter has, however, been brought under control after the arrival of the Assistant Controller of Prisons. Now, the Assistant Controller General of the Nigerian Correctional Service, Mr. Tosin Akinrojomo, has been commenting on the attempted jailbreak at that center, the Ikoyi Center. In an interview with our correspondent, Nelta Egbe, the controller explains that the pandemonium broke out following a fire incident at the administrative block, which some the inmates wanted to cash in on to escape.
All sister agencies are on ground, and we have been able to contain the crisis. No inmate escaped. We can assure you that corrections, we are doing what we are able to do to ensure that we keep the security of the custodial center. And we can assure the public that they are safe, and no inmate, no matter how terrible they are, have been able to escape from the custodial center. We are top of the crisis, and we can assure you that we'll be pleased at all costs. It was the attempt of the inmate to escape. That was why they set the admin block and the record office ablaze, so that there will not be record of any one of them that we can use in tracing them up. Unfortunately, we have backup data that we can get all these documents from.
All these happening 48 hours after the Edo prison break. Still staying with the situation happening around the end-SARS crisis. But let's continue to talk about the pandemic and what we're witnessing. Joining us right now is Dr Diola. He's a physician intensivist trainee. He joins us via Skype from Essex in the United Kingdom. Thank you for joining us on the program.
Thank you, Millicent.
All right, now you must have heard, watched news. We're battling coronavirus pressures, yes, but then there's the end-SARS pandemonium. How do you think we can separate the dangers and then tackle each of the crises facing us head on?
Right, thank you for your question. It is a difficult one. I'd like to begin by saying I do sympathize with all of you back home with the tragedies that have been occurring over the last few hours to days. It is a really sad period for Nigeria, and I hope the sooner we move away from this, the better for our country. I think in recent times, we've not had the sort of updates and information we're getting from the NCDC, which seemed to be the agency that was in charge of coordinating the efforts, or rather the lead agency that was spearheading the efforts against the coronavirus pandemic in Nigeria. So it's pretty much unclear what's going on with that at the moment. But from all indications, it does appear that the cases may not be as they were in Nigeria a few months back. With the protests, one would suppose that because people were in close contact, were bunching together, if indeed the disease was the virus was being spread was spreading from person to person, such protests will have enhanced the spread. But nonetheless, I think the general picture across Africa in recent times is such that it appears that the pandemic has sort of waned. The numbers coming from Africa generally show that, and there may be a few reasons for this. I think that the fact that generally the African population consists largely of younger people who have been said to be generally asymptomatic, not to suffer with severe symptoms of the illness. Maybe this is why we are not hearing such of news we're hearing earlier on. I think as far as SARS and coronavirus go, that is what and as far as the end-SARS activities and coronavirus go, I think that is what I can comment on that.
as a public health expert, of course. But then we're hearing the Minister of Health reminding Nigerians to still adhere to all the conditions and the non-pharmaceutical measures, especially when outdoors. It's rather a difficult situation or a difficult thing to do. Do you think that people are going to be listening to this at this time?
Well, it's hard to say. I think, but given the recent events in Nigeria, I think Nigeria may well be beyond that. There were days and days of protests where I think caution was probably thrown to the wind, if any. People, from what I saw in the videos, people were not adhering to those methods, and I believe that because they were protesting, the protesters felt that the cause for which they were acting for was superior to this one, for reasons best known to them.
All right, just before we let you go, tell us about what's happening, the latest across the UK. We know that is sweeping restrictions, especially in Europe and then the United Kingdom as well.
Mm-hmm. Yeah, most recently, last week, the UK has implemented a sort of stratified system of tiers, tier 1, tier 2, and tier 3, with tier 3 being the most severe. And some parts of the UK, a few million people been in the tier 3 regions. In these areas, they are not expected to leave the area, and a few other restrictions as well. Definitely the cases are more. In fact, the numbers from yesterday show that the cases are higher than they ever were in the pandemic. But I think the positive side of things is that the deaths, the daily numbers are far less than they were when you correlate with the number of deaths that there were for numbers that we had in March. So which shows that in terms of management, we're getting something right. In terms of the way we're tracking and tracing, I think UK, we can say that definitely doing better than they were at the peak of the pandemic. So
all right,
it does look
thank
good
you.
for us.
Okay, great. Stay safe. Thank you so much, Dr. Diola, a physician intensivist trainee from the UK. Thank you for joining us.
You're welcome. Have a lovely day.
Meanwhile, France today surpassed 1 million confirmed COVID-19 cases, a worrying landmark that came just over a week after French President Emmanuel Macron declared a national health emergency and a month-long curfew in France's major cities in an attempt to curb new infections. In Western Europe, the coronavirus outbreak in France is second only to Spain, which reached 1 million cases on Wednesday. Stay with Channels Television, your home for the news. And in about 30 minutes, Nigeria's President Muhammadu Buhari will this evening make a national broadcast at 7 p.m. This is according to the presidential spokesman, Mr. Femi Adesina, who says the broadcast follows detailed briefing by security chiefs on the current situation in the country. Television, radio, other electronic media outlets are enjoined to hook up to the network services of the NTA and Radio Nigeria, respectively, for the broadcast. You can find more updates on our website. That's channelstv.com. Thank you for watching. Stay safe. I'm Millicent Walker.